Welcome to the show. Let's talk health with Dr. Yash Gulati. During Corona times, a lot of other diseases suffered because our concentration was on Corona or COVID. Many patients who had kidney problems did not get dialysis in time. Many patients who needed kidney transplant could not get it done because either they were too scared or beds were not available in the hospital. To discuss issues related to kidney, we have with us a very eminent nephrologist, Dr. Rana, who is not only an eminent nephrologist but also is the chairman of Sir Ganga Ram Hospital. Dr. Rana, you are very welcome on this show. As you know, during Corona time, many patients were confined indoors. Even today, people are scared of going out, coming to the hospital because of catching Corona infection. As it is, people who are suffering from chronic kidney disease have lower immunity. So, does it have any effect on their kidney problem if they visit hospital for their kidney ailments?
There are two types of patients in, say, in non-communicable disease, whether related to kidney, heart, or brain. There are acute conditions where most of the time patients either approach the major hospitals or they approach local hospitals. But we saw a trend that we didn't see many acute patients coming to the hospital. Where were they getting treatment? I believe they were getting treatment in local hospitals. And what were the results? Probably someone else will do that, but I don't know. There were we didn't have many cases for coronary angiography, while otherwise most of the time all the three cath lab remained full. So what was happening to those patients? I believe that probably they were going to nearby places because they were too scared to come to Delhi and too scared to come to a major hospital where there are a lot of beds reserved for coronavirus. However, coming to chronic conditions like people on dialysis, those who were getting dialysis, I think most of dialysis even took care of them, and unless they were not able to come or travel, they got dialysis. At least I know about Sir Ganga Ram Hospital that we gave dialysis to every patient, and every patient was getting dialysis because not only to say our normal patients, but even COVID positive patients, we reserved 10 machines for that also, and we welcome patients from other hospitals also, those who were coming COVID positive, because it was not possible for many smaller units to reserve beds. But we have got 3 hospitals, so we reserved in one hospital all 10 machines for dialysis machines. As far as kidney transplants are concerned, those who required emergency, sort of a semi-emergency, kidney transplant as such elective surgery. What if some person required it and they were suffering or they are coming from far distances? We did transplant them. We saw a little more complication as compared to non-COVID patient, but we did a significant number of transplants during these 8 months also. And all over the country, some states, some institutions, especially I think probably in government sector, they don't do it all. But we did, and we found that some complications, especially I think we saw 2 unfortunate deaths because of sudden heart attacks, and they became COVID positive.
Dr. Rana, we all know, and it has been very well publicized, that patients who suffered from COVID had very bad effects on the lungs, on the heart, because of thrombosis or the clotting in the blood. Did they have any bad effect on normal people's kidneys also?
Yeah, we have seen a mild degree of kidney failure in many patients, but at least to my best knowledge, I have not seen any patient in our unit also. The patient who got converted into end-stage renal disease because of COVID, Most of times, such serious patients, those who get kidney failure and other things, they mostly succumb to the COVID disease, So I have not seen any patient which, because of COVID disease, he is on dialysis now.
And vice versa also, people who are suffering from kidney diseases, they were also not more prone to develop COVID. Was it?
No, they are little more prone. They carry little more risk of morbidity and mortality, but it's not so bad actually that they didn't survive at all. I think I will not be able to say exactly what is the difference between their survival or morbidity and mortality, but they did fairly well actually.
People, elderly population who are actually more at risk because of corona, also at more at risk for developing urinary problem because of prostate, difficulty in passing urine, and getting backflow and then causing damage to the kidney. And during this time, people did not come out, did not get treated. Did you see any increase in cases because of that?
No, no, yes, I didn't see. But what I say that the fact is that we really do not know much about this disease even after 9 months or so.
Sure.
Why? It is important that many people are affected, younger and older also. Most of time, the older patient, those who become symptomatic. Many young patients, they remain asymptomatic or they just pass on very normally now. But at times, even a younger patient without any, I have seen younger people dying without any comorbid conditions. At the same time, we have seen 90 plus people having comorbidity also still going back home,
Sure.
So it is not, we really don't know what is determining their morbidity and mortality. But this one part is very clear that most of time, most of the mortality or deaths they have been seen in elderly patients, and that has increased after every decade. They starting from fifth decade onwards. Every decade there is increase in death, and more so in males as compared to females, But we have seen deaths even in younger people. Of course, we don't deal with children, but I can say in adolescent, we have seen disease, but most of the time disease is very benign in younger people.
Dr. Rana, in other parts of medicine, people have been advising about good diet, good exercise, good sleep, and good other things. About renal issues, about urination, what would be your advice to people, especially people who are confined indoors and especially people are scared?
I shall advise that actually because of corona, most of people are not walking, not doing any exercise outside or say, so it is very important that they do some sort of exercise at home. They do yoga exercises, and of course, healthy food, whatever being nowadays being told on television or by some doctors also that this is immunity boosting. That may be immunity boosting, but that is advisable in normal circumstances also. There is nothing that with COVID that for combating COVID you take very high protein diet or something like that, I don't believe in that. But of course, one has to take healthy diet to keep himself healthy.
Yeah, and during this time, people
these are myths. I don't think that this is something
Sure.
like take 6 eggs or say take a lot of chicken or something that helps.
Yeah.
What you require to take healthy diet at
Good
the same
balanced
time.
diet.
Good balanced diet. At the same time, you are because of corona, you're most of the time confined in house. If you're taking a lot too rich diet, you're going to not, number one, you may not be able to digest it.
There
and
have been
number
some
two, you will
reports,
gain weight
Dr.
also.
Some reports about these keto diets and all that, where they've been taking a very high concentration of protein. There were some reports of damage to kidney. Is that right or?
I still say that refrain from those diets.
Yeah.
Those diets should be taken only under medical supervision. Those diets are given to patients suffering from kidney failure, and that too under medical supervision. I don't recommend such diets.
Yeah, and as an administrator of a very large hospital, have you brought about a lot of changes in your hospital to deal with the situation?
Yeah.
And are we back to
I
almost
didn't
normal
know.
now?
We didn't know much, but we study from, say, literature. We study from literature outside country, inside the country, and we did a lot of modification as far as air conditioning was concerned in the whole hospital, so that we increase the flow of fresh air. At the same time, put exhaust in every room, which is against the principle of air conditioning, but just to wash out, keep the more fresh air and go on throwing away the, say, humidity air. So almost the whole hospital did. Then we put a lot of tents outside the hospital so that you can maintain distance, At various places we put this, sanitizers and facility for hand washing. And that is all what is so, because we after lockdown we started running our OPDs normally, which we have been running till today now. There is always up and down. Month back we have almost returned back to normal as far as OPD is concerned, and as far as indoor admissions are concerned. But third wave brought down everything very badly.
Yeah, but
And
that
now
hopefully will go again.
after 3-4 days, after last 3-4 days, everything is picking up again.
Right. Dr. Rana, can you please tell our audience, are there any warning signs about our kidney and urine, passing urine and other things, which we should be aware of? And if something like that happens, they should immediately consult a doctor.
I think, there are not very specific symptoms of, which are totally specific to kidney disease only. Some patient, well, like somebody not passing urine, then that is very normal. That
And there is this thing that you must drink 3 liters of water.
no. That is also.
What do you believe in that?
Anything I think if you are like, let us say, if you are getting swelling, unexplained swelling over feet, face, you should consult your doctor. Not necessarily kidney disease. Similarly, if you are having loss of appetite or weakness or tiredness, then one of the reasons can be kidney failure.
And if you're passing less amount of urine,
Then obviously, if you are passing less amount of urine, you are not passing urine, then anyway, even the one who is not doctor, he will also know that this is kidney disease.
right?
But most of time, people who are suffering from advanced kidney failure also, and I think more than almost nearly 70% people, they will continue to pass normal amount of urine.
Is that
So,
right?
yeah, so passing normal amount of urine, many people will come that we are passing normal urine, how can we have kidney failure? But it will happen more than 50% patients. Nearly 70% people continue to pass urine till last.
So that's an important point. That
That's
is
important.
not.
So it is not important that
Yeah.
that you stop passing urine. You stop passing urine only in acute kidney failures, not in people those who are suffering from chronic kidney failure. However, in a people like patients suffering from diabetes mellitus or other glomerular diseases, most of the time people get swelling, but they also continue to pass urine also. So, but the big moment the kidney failure starts setting in, then hemoglobin starts falling down. People start feeling tiredness, weakness, and as the things progress, they continue to have loss of appetite. But at times, people's kidneys are working hardly 5 to 10%, and they're not having any symptoms at all. They're not
Is
ready
that
to.
right?
Yeah, somebody kidney may be working maybe only 5%, but they're totally asymptomatic and they don't feel anything. They feel all right. Hemoglobin may be only 6 grams. Then they're because the body has adapted to it.
So how can we prevent that? Is regular health check and also?
Yeah, so answer, you're right. Say, people those who are diabetic, people those who are having high blood pressure, they should have at least once in a year or twice a year their blood creatinine, blood urea, and urine done, and ultrasound after age of 40 years. Occasionally, you should have ultrasound your abdomen also. And otherwise, there are many kidney diseases which starts maybe in the very first decade and presents in second and third decade, and they are totally asymptomatic patients. So this is very difficult, So unless you are having something sort of normal urine examination, all school kids should have urine examination or normal checkup. Hypertension should be picked up at that stage. We should be able to pick up the stage. We may not be able to reverse those diseases, but at least we can prolong the stage of end-stage kidney failure.
Thank you, Dr. Rana. Very good words of wisdom. So, as Dr. Rana said, that kidney disease may not be diagnosed late because you can continue to pass normal urine till it's very late. And it's very important for people who are diabetic, hypertensive to have regular health checks so that if some kidney problem is occurring, then it can be picked up early and remedial measures can be taken. This can affect children, this can affect elderly and middle-aged patients also. But diabetics, please take extra precautions, do regular check. Everybody should do regular checks after a particular age, and we must catch these diseases early so that they can be treated. Dr. Rana, very grateful to you for coming here. Thank you very much indeed.